Hi, I'm Dennis Holmes. I'm a breast cancer surgeon and I'm medical director of the Los Angeles Center for Women's Health. I specialize in the treatment of breast cancer with this particular focus on oncoplastic breast surgery, which is a type of surgery that removes cancer while preserving and in many cases improving the appearance of the breast. I also specialize in intraoperative radiotherapy, which is a type of radiotherapy that's given entirely during surgery. So instead of the usual 30-day course of radiotherapy that someone will receive after lumpectomy, I'm able to give it while the patient is asleep under anesthesia as a single treatment at the time of surgery. Now, all of this was a result of years of training, and most recently, I trained as a breast cancer expert, breast cancer specialist at USC, University of Southern California, and prior to that time, I trained as a general surgeon at the University of California, San Francisco, and Washington University in St. Louis. I became a doctor because as a child, I had a number of medical illnesses, and I decided at a very early age that I wanted to be a part of restoring health just as my doctors did for me at that time. Years later, my interest in breast cancer surgery and in surgery in general was shaped by the fact that a number of my family members were diagnosed with cancer. My mother, my father, and my significant other, all within a 2-year period. Obviously a devastating experience, but one that helped to change my focus from taking care of people in general to taking care of breast cancer patients. I chose to practice at the Los Angeles Center for Women's Health because it gave me the opportunity to pursue my personal mission, which is to change the way that women's health care is provided in this country. That really was based on 2 opportunities. The first was to be involved in the design and construction of a state-of-the-art, comprehensive women's health center that brings together the best features of women's health centers from around the country, all together here under one roof. The second thing it allowed me to do was to handpick, to recruit a team of nationally recognized women's health care providers who share my mission and my dream of working together as a team, who share the value of taking together a patient, the whole patient, all together, so that the patient doesn't have to travel from one part of the town or to the next to take care of her heart health concerns here, her breast health concerns there, her gynecological concerns there. With the team that we brought together here at the Los Angeles Center for Women's Health, we can take care of all those concerns as a team in one place. My favorite part of being a breast cancer surgeon is the opportunity to take someone who's been terrified by having heard the words, "you have breast cancer," and guiding her along this path to recovery. That begins with making sure that she understands what the diagnosis means and what the treatment options are, making sure that she understands that this is just a moment in what will likely be a very long life for her. It's a very terrible moment, but it's one that I and my teammates can get her through. I want her to know that we will bring to her the best treatments that are available, treatments that are less invasive, with fewer side effects, and ultimately she'll get through this experience feeling that her life is more fulfilling than it's ever been before. And helping someone get to the point where they understand that is really what makes my day. Someone coming to me to see me for the first time should expect that they'll meet someone who really cares about what's going on, cares enough to listen to their concerns about the diagnosis, cares enough to spend the time with them to make sure that they understand what they're dealing with, what the treatment options are, cares enough to be involved in the ongoing research to find better ways to treat breast cancer, approaches that are less disfiguring, less burdensome, that has less long-term side effects. That's really what drives me and what women should expect to see when they come to me for treatment. They should understand that they're dealing with someone who's kind of at the top of the game, that is involved in leading discussions about how breast cancer should be managed, leading research, involved in all the national conferences that occur around the country, someone that breast cancer experts go to for advice about breast cancer. I do it all the time. That's what they can find when they come to see me.